knows.
With schools and now summer camps looking more normal than they have in more than a year, experts are warning this transition back to life as we knew it could be challenging for children. Dr. Eileen Kenned-Moore is a psychologist, author, and mother of 4 whose work focuses on parenting and children's feelings. Dr. Kenned-Moore, what are some things that parents can do to help children and teenagers with the transition to regular life?
Hi, Gerald. So the most important thing is to start with empathy and normalizing whatever feelings our children are having. So you might say something like, of course you're nervous about this. It's been so long since you did that. But we also want to convey that we're 100% sure that they can handle it. So trust in your child's strength to be able to handle these new experiences. If you're calm and relaxed about the new opening, the new activities, it's easier for your child to be calm and relaxed about it. If you're nervous yourself, you can use that too to talk about, well, I'm a little nervous, but this is what I'm doing to handle my nervousness. And that might be, I'm doing it anyway, but I'm telling myself it's going to be okay. The CDC says this is safe.
What are kids most concerned about when it comes to going back to school?
Kids can worry about a lot of different things, the same as we adults can. They might worry about the virus. They might worry about being separated from their parents when they've been together for so long. They might worry about the workload or whether the teacher is nice. But the number one concern for most kids is about friends. Kids want to have friends. They care deeply about having friends. In my practice, one of the main questions that I ask to figure out how is a kid doing is, does this child have someone to sit with at lunch who they like, who likes them back? So anything that we as parents can do to ease the way towards friendship is very, very helpful. This could mean getting together with friends at outside of school, before school starts. It could be signing them up for camp so that they can get to know people that they maybe haven't seen in a while. It could be supporting them with play dates, or maybe even having somebody to walk into school with so they don't feel like they're doing it alone.
You know, as parents, we always think we know what's best for our children, and what worked for us should work for them. What's the worst thing a parent can do or say during this transition?
I think if we focus on the anxiety that the kid might be feeling, there are 2 things that we can go wrong on. So the first is if we protect the kid too much. And that's telling the kid, oh, you're too fragile to do this, or this is too dangerous for you to handle. And we don't want to do that. The other thing is to dismiss their fears and to say, oh, don't worry about it. You shouldn't be scared. There's nothing to worry about. Well, they are. So again, we want to focus on that empathy, but also the confidence that I know you can handle it.
All right, help them be independent and make this exciting for them.
Exactly. We can also focus on that scared feeling is also mixed with excitement. How wonderful to be doing these things that they haven't done in so long. A friend of mine recently took her 7-year-old to the grocery store, and he hadn't been in like a year and a half. So his eyes were like saucers looking around at all the things on the shelves. So we can also enjoy the novelty and the excitement of the world opening up for ourselves and for our kids.
Life's simple pleasures. Dr. Eileen Kenned-Moore, thank you so much for your time tonight. We appreciate it.
My pleasure.
You can see more of her work on her Psychology Today blog. She also teaches the online course, Raising Emotionally and Socially Healthy Kids. It's available on the Great Courses